Dr. Selwynn Howard's show. With me today are two illustrious members of my graduating class from Howard University. It will be our 30th anniversary from graduating from medical school. So in honor of the class of 1991, I brought on these two ladies, and they're very unique in their own special ways. They are two orthopedic surgeons, two Black female orthopedic surgeons, and I would have to say they are a very rare quality in the world of medicine. In my 30 years after graduating from Howard, I've only come across two females in general, and that was during my residency at George Washington. In my stay in Georgia, I have not come across any female orthopedic surgeons at all. So I actually want to have a third member of our class here. I was not able to get Dr. Vestinia Polk. I don't know what her married name is.
Bridges.
So that would have been three. And I think Emily and I were talking a little earlier. We had a total, I think it was 6 orthopedic surgeons in our class.
Yes.
A really high number. So I'm going to introduce these ladies first. We'll start off with Dr. Emily Woolcock. Dr. Emily Woolcock, as I mentioned before, is a proud member of the class of Howard University College of Medicine 1991. Her undergrad studies, she attended University of Connecticut. After graduating from doing her residency at Howard University, she did a reconstruction fellowship at Hennepin County up in, where is that located, Emily?
Minneapolis, Minnesota.
In Minneapolis, Minnesota. Emily has gone on to establish the Orthopedic and Joint Replacement Institute with offices in Florida and Southeast Georgia. She launched the Accident Rehabilitation Center in Jacksonville, Florida, to address the often ignored orthopedic needs of car accident victims. And she also, in 2011, established the headquarters of the National Orthopedic Consultants, which is an orthopedic practice that offers traditional care in addition to expert witness training and consultations. Welcome to the show, Emily.
Thank you. Thank you, Dr. Howard.
Well, it's very nice having you here. And we will talk about your entrepreneurship as well as your experiences as an orthopedic surgeon. Now, our next guest is Dr. Stephanie Stevens. Dr. Stevens specializes in diagnosis and treatment of sports-related injuries and conditions of the knee, hip, ankle, foot, shoulder, elbow, and hand. She's a graduate of Duke University, where she was a member of the women's track and field team. She went on to hold several records in the 140-meter hurdles. She is a graduate of the illustrious class of the Howard University of 1991, where I think Stephanie, even though she was low-key, probably finished in the top 5 in the class.
Not quite, but close.
Top 10. Top 10?
Top 10.
Top 10, okay. It wasn't too far off. Well, I wasn't in the top 10. So that's still quite an accomplishment. Both of these ladies are board-certified orthopedic surgeons. Stephanie went on to do a residency at the Hospital for Special Surgery in New York, and she also did a sports medicine fellowship at Hahnemann University Hospital in Philadelphia, Pennsylvania. She currently practices in the greater Dallas, Texas area. And both of these ladies are both wives and mothers. So welcome to the show, Stephanie.
Thank you. Thank you. Appreciate it.
Not a problem at all. So what we're going to start off with this is both of y'all, I mean, we're going to go back and forth, but what I'd like you all to do is starting off with you, Emily, just give us a history about yourself and what drove you to become not only a medical doctor, but an orthopedic surgeon.
I wanted to be, according to my mom, as long as she could remember, a medical doctor. She told me that the first year of my life, I spent that year in and out of the hospital. So maybe that was where I developed my affinity for medicine. And I remember as a kid watching medical shows like Marcus Welby, MD, and, back, people watching this probably don't know what I'm talking about, but yeah, that's what I did. And so I've always known I wanted to become a doctor. And in college, at the University of Connecticut, during the summer programs, I took part in pre-health summer programs, trying to further my interest. I would volunteer at the hospital in Waterbury, Connecticut, where I grew up. And I was just so happy to actually get into medical school. The fact that I got in when so many couldn't is not lost on me. So early on, I made it a thing to make sure I reached back to people coming behind me to help them along in the process. You know, I remember my first year of med school, before the internet, I wrote a book, my first book, on how to get into medical school, where I listed all the minority oriented summer programs in the country, and kind of explained the whole process from top to bottom on how to get in. Well, back to my residency, I decided on orthopedics because I was a tomboy. I like working with my hands. And I remember during one of my surgical interviews, the interviewer said, well, if you like to work with your hands, why don't you knit? But I really enjoyed working on projects with my dad on the weekends, you know, and orthopedics was a lot like that. And I'll never forget walking into the operating room at Howard University the third week of my third year of medical school. And Dr. Grant was the chairman of the department at the time, and he was calling for the saw. And I went over to the operating room table and I saw screws and a hammer and plates. And I was like, this is for me. This is where I belong. And from then on, it's been history ever since.
I hear you. Now, Emily, you're very unique in the fact that you were 19 when you started medical school. How did you get on that track that you were so young coming into medical school? I thought I was young at 21, but 19, you still were a teenager.
Yes, I started school in Monrovia, Liberia. My family relocated to the United States when I was a junior in high school. And at that time, I was 13 and a half, going on 14. So when we came to the United States, my parents couldn't enroll me in public school because they wanted me to go back to the ninth grade to be age appropriate. So I ended up going to a private school in Connecticut, Sacred Heart High School, and they allowed me to continue at my level. And the funny thing was, most of the curriculum at the high school I had already taken in lower years. So I spent a couple of years at Sacred Heart High School, graduated there at the top of my class, and then matriculated on to the University of Connecticut at age 16. The first year of college, my dad did not think I was old and mature enough to go on campus. So he switched my registration to the regional campus, which was only 7 minutes from the house. And I had nothing else to do but study because my parents were very strict. I wasn't allowed to go out. I was only 16 at the time. So that first year, I got 52 credits. So at the end of the first year, I was a junior, and I was able to transfer to the main campus and graduate before my 19th birthday, actually. But by the time I came to Howard, I had turned 19 over the summer.
Yeah. Your father sounded like he was a smart man. You shouldn't have been on college campuses at 16. So, okay, Stephanie, let's talk about you and your track to become an orthopedic surgeon.
Okay, so for mine was more geared around athletics. I ran track throughout most of my life. I knew I wanted to work with athletes. Kind of like Emily, I was very hands-on, fix-it type of person. I think I got that from my father. He and I, if something broke, mother would want to go buy something new to replace it. We said, no, we can fix it. We can fix it. So we were constantly taking things apart, putting them back together. And so that was something that I had with my dad that kind of made me want to try to fix people. My father was a dentist, so he was the only other healthcare worker in our family. And I always kind of matriculated toward that type of environment of something I was interested in. Initially, I thought I wanted to do the easy route. A lot of my colleagues would tell me, and friends and other students would say, you don't want to do surgery, that's too hard. If you want to deal with athletes, do the medical track. So going into college, I initially thought I was going to do family practice and specialize in sports medicine that way. And over the summer, I did a couple of rotations and I thought, this is great. I'm dealing with athletes. But as soon as they came in with an injury that was something that required surgery, we immediately sent them out. And I thought, wait a minute, I'm not getting to see how this ends. I want to be able to fix them from beginning to end. And so very quickly I realized, you know what, I don't care how hard it's going to be. I want to be able to fix them, make them better, and see the outcome of what my hands have been able to do. So I did a rotation in Northern Virginia with a Black orthopedic surgeon, and was amazed at how much I could help with hands on and do the surgical route. So once I decided surgery, I never changed. And that was kind of unusual for our medical school. A lot of people didn't know what they wanted to do when they started. I knew orthopedic surgery from day one and never changed it. I have no regrets about that. And I try to counsel other people that come in, you know, you don't have to be so certain of what you want, but if you are, to me, that made it easier for me. I didn't have to decide. I always knew what I wanted.
Yes, you were very driven. I remember you very, very well, very determined. And the athletic thing, I think, was really good for you. At Duke, you ran track. Did you help start the track program, or what did I know about that?
I started at Duke well, I graduated in high school in '83. And so in fall of '83 and into '84, there was no women's track team. If you wanted to run track at Duke, you had to either do intramurals or run on the men's team. And there were 2 women distance runners who were on the men's team. And I really didn't want to do that. So I ran intramurals, but I thought, this is crazy. We're at a big university and they don't have a women's team. There were 2 other sprinters who were on the intramural team with me, and we all kind of had the same idea. So we went to the administration and said, hey, why don't you have a women's team? And they said, well, we don't have a coach. If you all can find a coach, we'll start a team. So the 3 of us went out and had been practicing on the track, ran into a gentleman from the community who was actually a former Olympian, lived in Durham, and was just working out on the track. And we said, hey, would you like to be our coach? He said, sure. So we brought him over, and the 2 distance runners from the men's team joined us. And so 3 sprinters and 2 distance runners our sophomore year were the team. We had 5 members of the women's team in 1984. By the time I graduated, they were giving out partial scholarships. We had a full team at that point. Unfortunately, it was too late for me to get the scholarship, but it was great to me, you know. And it's funny to say that I helped found the team, but to me, it was so unheard of that they didn't have one. It just wasn't natural. There had to be one. So it was an easy thing for us to kind of make happen.
Right. And I think since that time, Duke has grown so much as an institution that's worldwide known because of the basketball team and Krzyzewski. And, you know, I still have headaches of Duke beating my beloved Georgetown team. I know you rubbed it in because you even knew some players at the time on that team.
Yes.
But that changed the trajectory of college basketball. So
and Duke and UConn.
Duke
and UConn, yes.
Yeah, they really did. And the men as well. So both of you all, as far as orthopedics goes, what are the things that you all like to do? I know some people are hand specialists, some people do backs, some people do joints as far as hips, some people do knees. What do y'all like as far as the orthopedic part of the process? You can go, Emily.
My favorite part is the surgical part. I can sit in the office all day and talk with patients, and we have a great time. But in the operating room, I seem to come alive. My subspecialty training was in joint reconstruction. And as it stands now, I still remain one of only 6 Black female Americans in the United States who are joint reconstruction specialists. I do hip, knee, and shoulder reconstruction. But in addition to my subspecialty training, I do general orthopedics. So I do a lot of arthroscopies, which is encroaching on Dr. Stephanie's territory, carpal tunnel releases, rotator cuff repairs, and for any kind of fracture repair.
Okay, so Stephanie, I want you to add on to that what you like, but also I want you to cover this too. You know, it's spring now. a lot of, we're coming out of this pandemic, so we have a lot of weekend warriors, especially our ages group. So you're looking at sometimes the wear and tear on these joints can be a little much. Tell us about some things we could probably do to try to avoid seeing you guys. I know that's how you get paid, but
well, yeah, that's what keeps us in business.
well, there'll be enough of us that'll keep you in business, no doubt.
Right.
So tell us a few things about what you like and some of the pitfalls that a lot of people get into.
Sure. So in terms of what I like, my fellowship was in sports medicine, which is mostly arthroscopies, but also I do open procedures. I do arthroscopies of the shoulder, of the knee, of the hip, of the ankle and elbow. My favorites are the shoulder and knee. But I also, as Emily does, I'm a general orthopedist. So I also do joint replacements. I do hip, shoulder, and knee replacements. I take emergency room calls, so I do fracture care. So I pretty much handle everything except the neck and the back. But my favorites are the scope. And it's, as Emily said, we can be in the office all day long, and I really enjoy talking to people and helping them and learning things about them. But I would much rather be in surgery, and I don't get tired. I could go all day and not realize how much time has passed, because you get just a different gear that you run into when you're operating and you're creating with your hands. In terms of the weekend warriors, we're seeing a lot of that now, because a lot of people with COVID, because of the pandemic, they're working from home. And they've got a lot of extra time on their hands. And a lot of them are deciding, well, I'm home, I might as well get into shape. And they try to do it all at one time. Or like we're all guilty of, I used to run, so I think I could go out and run like I used to. Well, it doesn't work that way. The body changes. And after you've been sedentary for a while, that's where these overuse injuries come in. So the biggest thing you can do is try to be honest with yourself and start slow. If you haven't walked since last summer, don't go out and walk where you left off before. You got to start slow. If you normally walk 3 miles, you might only start with 1 mile. You might do it by time. If you normally walk for an hour, you might start with just 20 minutes and work your way up to it. We tell patients, don't increase your distance and your intensity by more than 10% per week, because by doing that, you're more likely to get pain. We see a lot of people try to run a half marathon because they used to run, and we get stress fractures, we get tendonitis. A lot of patients are coming in with these aches and pains. And so the biggest thing I can tell them is you have to back off, treat it, rest, anti-inflammatories, ice, and when the pain settles down, get back into it. We don't want you to stop, but you have to go at a slower pace and ease into it.
Okay. So let's get back to Howard University. Now, both of you all went to schools that were not like Howard, but Howard was actually not like we thought it would be either. It was much more integrated than most people realize. What was some of the things that you guys had to adapt to? Emily, being so young and it really fresh to the country, really, you were exposed to the Howard University way. The reason I want you all to talk about this too is that, there is a resurgence of people talking about the historically Black colleges and universities, but there's also some things that people don't know about the schools, and they have some misperceptions about the schools. So both of y'all had different experiences. I went to Morehouse, which is an HBCU, so mine was a little different, but it still was unique in the fact of going to Howard. So Emily, if you want to talk about that. And the other thing too, I want people to see that you guys are exceptional. You guys are high achievers, but at Howard, you all also, you partied a little bit. I mean, we say too much. Good thing we don't have cameras or anything, but I know that you all had other lives outside of just your the challenge of being a medical doctor. You all experienced different things. So go ahead, Emily.
Okay, I went to the University of Connecticut undergrad in Storrs, and the campus was large. I think we had about 25,000 students on campus. My classes at the University of Connecticut were very large. We were on a numbering system, and back then the number was just a security number, and that's how you were identified in class. Coming to Howard, the classes were much smaller. more people looked like me. And that's one thing I didn't address. I was usually either the only person in my particular class, especially as I got into the upper classes in terms of person of color, or of one or two. So when I came to Howard, that ratio was flipped. We had students of all ethnic backgrounds in our classroom. There were whites, there were Chinese, there were other Asians, Indians. So it was nice to have that diversity. That was different from what I experienced in undergrad. Also, I felt that the teachers at Howard University were more vested in us personally. That was an experience that I didn't have at the larger university, where you were just one of a number, because most of the professors there didn't even know me by name. Whereas at Howard, even people that you did not have as professors knew who you were. And that made a difference. And that inclusion for me was a big part of my maturing and growing as I did and excelling.
All right, Stephanie, you have the floor.
I think for me, it was the biggest thing was coming from Duke, where 95% of the students there were white. Coming to Howard, it was such a welcome change for me, not just having other people that look like me, but the biggest thing for me was seeing some of these instructors and these attendings that were phenomenal women and men, brilliant minds. And I had never been exposed to that. I didn't have instructors at Duke who were Black unless it was African American studies. So seeing that these phenomenal people, these were people I wanted to emulate. I wanted to learn everything I could from them and be like them. And it was very welcoming to be able to do that. And also, as Emily said, the diversity in the class. There were, someone from every race, ethnic background that you can think of were in that class. And we were all very close because it was a small program. And being able to have a study group of diverse people and being able to make lasting friends. I mean, there are people, I don't know if you all remember Rhonda Souza. She's up here. She called me up one day, looked me up through the Baylor system, and we had lunch together. And it was wonderful just to see somebody from 30 years ago. But those feelings are still there. And I don't know that I could have built those kind of relationships being in a large program at a large school. So I think it was something that took some of the stress away, because there's enough stress with all the education that you're trying to get and all the learning you're trying to do. You don't need that social stress on top of that. So that kind of allowed us to ease into it.
Yes, I would agree. I think the rigors of Howard were very challenging for all of us, and then we did need that outlet. But I would be an ambassador to the school as far as welcoming potential students there. And I know I got some raised eyebrows when I would tell them that you're in one of the most diverse schools that you'll be in. They just didn't realize that.
They didn't think that, yeah.
They didn't think that, but that actually was the case. So It's just unique in its own way. But, the thing about it that I admire about you guys, and I appreciate it, is that you guys were very humble. Like I said, Stephanie, top 10, you would never know it. You think she just, oh, ho, hum, and then you look up and see, there she is right there. But, the struggle that we all went through, sleeping on sofas in lounges and, going to the closed DC General Hospital. We had to draw our own labs and take them to the laboratories and do our own EKGs on the floor and have all these patients at a time that, we still got through it and we moved on. And it's good to see that people are doing well. So, you guys are both, not only are you professionals, you are wives and you are mothers. Talk to my audience, because we have parents who listen. We also have a few youngsters who listen as well, about the challenges of being all of this together and still making it work.
Well, I can say I had a late start. I didn't get married till I was 40, and I had my son at 41. So I'm an older mother by traditional standards. So I had my career established for 10 years before I became a mother. It was that probably made it a little bit easier for me. I had income that I could pay for people to help. I could take some time to be with him, but it is a struggle. Even now, I don't spend as much time at home with him that I would like to. But yet I'm at every basketball game I can go to, every PTA meeting that I can make, I try to make. Technology has made some things a little bit easier, that you can be there virtually if you can't be there in person. But I think that's made a difference. It is definitely not impossible to be a doctor and being a mother. I think it actually enhances the way I care for my patients. A lot of times I nurture them in a different way. And I think patients sometimes come to see me as a woman doctor because I listen. They constantly say, you listen so much more than that other doctor. This makes so much more sense than what he said. I get a lot of second and third opinions because of that. So I think it's been definitely an asset.
And Emily, I want you to share your thoughts on that as well. But also, you can go on and delve in about some of the things that you're doing as an entrepreneur as well.
I had my first child during residency, during my third year of residency. And that was difficult because being pregnant was frowned upon during residency. There were no allowances for pregnant mothers in an orthopedic residency because, first of all, it was a male-oriented specialty, right? And here I was in the program, and there was no allotment for maternity leave. So I was third year, so my fourth and fifth year vacations were combined into the rest of my third year vacation to create that period for maternity leave. So once I went back to work, there was no more vacation time. So that was a little difficult trying to balance, being in a hospital all day and trying to raise a young child. Luckily, my sister, who is also a physician now, she was graduating from college at the time, and she took a year off to come live with me to take care of my baby until she was old enough to, I could drop her off to on daycare during my chief year. So that helped. And then I had my second child during my first year in practice. And she was born with a diaphragmatic hernia. And that was another lesson to learn. I had to be away from my practice suddenly for about 6 weeks because she was on life support for about 6 weeks. We didn't think she would make it. When she did come home, she came home on oxygen, apnea monitors, and all kinds of medications. And I was told by the treating physician at the hospital that I could not go back into my regular routine, or else there would be a problem with the Department of Family and Children's Services. So my parents held me with her. I had to ease back into work slowly. And then I had to find a way to manage all this. And by 2 months after she was born, right after she came home, I found out I was pregnant with my third child. So I say I found out, but as if I didn't know how that happened. Well, that was different. And that started me looking for alternate ways to practice, to have a practice that fulfilled me, fulfilled my, that I was able to practice my skill, but yet try to be a decent mother to my children. And I have learned to do independent medical examinations during residency with Dr. Grant, who was the chief of orthopedics at Howard. And after I finished my fellowship, I spent 6 months working for a firm in Minneapolis, running around the state doing IMEs on a full-time basis. So I was able to incorporate that into my practice. And what that did for me was, because of the revenue that an exam brings in, it will take the place of about 8 to 10 follow-up patients. Okay, so the more I did, the more income came into the practice, and I was able to hire a nurse practitioner or physician assistant to help me with my clinical patients. But that freed me up to be able to do these exams and then do that paperwork at home where I spent time with my children. And therein that was born. And that has become one of my passions about families out there trying to find time to spend with each other, or single mother physicians, or anybody who's interested in the medical legal field. And that branched into my training, or starting to do one-on-one training with other physicians in medical legal practice. Fast forward to 2016, when I established the IME Academy, where I train physicians that are disillusioned with their practices. They're burnt out, physician suicide is a problem. So we want to kind of steer you away from that. There are many other things you can do within the scope of medicine, but independent medical examinations is one thing that I have done. It's true and tried. It has been successful for me and my way of life. And I'm passionate about passing that down to other people who are looking for a solution to make things work out, to balance that, to have that work-life balance. Also in my practice, as I matured over the years, one of the things that was not lost on me was the opportunity that I have had to become an orthopedic surgeon. And I've always had students rotating through the practice, and I've always acted as a mentor. And the students were on all levels. There were college students, there were medical students. So students from medical schools who actually come to my practice and do a rotation in orthopedics. My practice was huge. I was the only orthopedic surgeon of color in both Southeast Georgia and Northeast Florida. So at any given time, I had over 6,000 active patients in 3 offices. So I was going all the time. So there was a lot for students to learn. They came in and learned how to assess orthopedic injuries. They learned how to put on casts. They came to the operating room with me. And that also sparked another passion, because as we see today, we see a lot of kids who don't have access, like Dr. Stephanie mentioned, and I didn't mention at the time. It's nice to see someone in a position of authority that looks like you. Okay, it gives you that added push, to want to achieve more, because if they've done it, then you feel like you can do it too. So like I said, I've been mentoring students from high school on up, and I decided to reach down to the younger students, the younger babies, because some kids, by the time they get to high school, it's too late. And because we, as Black physicians, we make up less than 5% of our physicians, it's not likely that every Black and brown kid is going to see a Black and brown doctor in their life. So I started a children's book series called the Look Like Me book series. And the title is the first title is My Doctor Looks Like Me. I'm also writing titles for My Lawyer Looks Like Me, My Pilot Looks Like Me, and so forth and so on. But we started that program to try to distribute these books to kids, underprivileged kids, who would not necessarily have an opportunity to meet a Black doctor, and let them know that this is not impossible. This is entirely within your realm. If I can do it, you can do it too.
Yeah, so I think, Emily, I really admire that, because I don't know how many times I've sat down to start writing a book. One has not been completed yet, but it's in the works here. We'll get one done soon, but it takes a lot of discipline to sit down and really write a book and complete a book.
Yes.
Maybe I'll put all of them together. It may be a little disjointed, but there'll be a book.
Okay.
So,
yes.
Before we let you guys go, because you all are very busy, I know Stephanie has to do some motherly duties, and she owns this young son of hers as far as his basketball endeavors go. I want y'all to leave us with something. DMX, very popular rapper, died this past week, and he's very much glorified, and we respect what he does. But my thing is, ladies like yourself, you should be known. I mean, I think with the internet, maybe things are opening up that people will see people like you. It won't be that big a deal. But 30 years in the game, you were doing this a long time ago. It's not, some people are thinking this is something new. That's kind of one of the reasons I want this program out, to show people that we've been doing it for a while. This is nothing new, and it can be done, because that impression, sometimes when you see a person who looks like you, it kind of decompresses your your worry and your fear, that you've seen it done before, so you all can do it. So if you would leave us with a little something of as far as encouragement to those who are out there trying to find their way.
I think that the biggest thing is to make sure, you know, you have to be able to dream it first. And I've had patients even say to me, I didn't know a woman could be a doctor, let alone an orthopedic surgeon, just to be a doctor. And I get a lot of young women that come into the office, their mothers say, hey, I want you to meet my other daughter. Can can I bring her along? So you have to see it first before you can even dream it. And then once you can dream it, I think realize that it is possible. See us. I want Emily and I to be visible so that young women coming up can say, hey, if she did it, I can do it. I want them to know that this is normal. This is not just a rare thing. We are rare in our own right, but at the same time, it shouldn't be that way. There are going to be more and more of us. And so I think as much as we can make ourselves visible, they have to realize if you dream it, you can do it. So don't be afraid to ask. Don't be afraid to ask somebody, hey, can I come watch you? We try to be open and let students come in and observe us, because they don't realize just what they can become. I think women can be anything that they want to be. They just have to believe it. And so that's what we're here to show them, that it can be done.
No doubt. And Emily?
Yes. On the tails of what she's saying, I think when a child sees an adult that looks like them, that does something for the psyche of the child. And you can do it. We did it. We didn't come from bags of riches. We were not rich kids. We were regular kids. We grew up. Our parents had 2 jobs each. And, so it's not something that's reserved for people of a certain class. Anybody can do it. So if you do well in school and do what is asked of you and strive, you can do anything you want to be. And that's what I stress in my book. I talk about a kid who goes to the pediatrician for the first time and sees a doctor that looks like him. And they're from this lower middle class neighborhood where, nobody is a professional in that neighborhood. And the child had been under peer pressure because he would tell his friends and his neighbors, I want to be a doctor. And they would laugh at him and say, nobody's from our neighborhood going to be a doctor. Stop dreaming. So he goes to the doctor and comes to find out the doctor came from that very same neighborhood. So imagine that bond that child felt. So I want to take it further. Like Stephanie said, be visible. I've started a book club where the kids can actually come in. Parents can register their kids for like $5 a month. And they can come in and see live physicians like myself. And I will be sending an invitation to Dr. Stephanie and to Dr. Howard to join me in the club room with the kids, where the kids can actually come in and interact with us and know that it's real. It's not just in the storybook. It's not just on TV. It's real. They can come in and meet Dr. Stephanie. They can meet Dr. Selwynn. They can meet Dr. Emily. And I think that would be so fulfilling. It's just a start. It's just one thing that I've thought of, and I'm hoping to get some collaboration to grow from there. A couple of days ago, I did a Zoom program with students in Charlotte, North Carolina, an elementary school in Charlotte. There were like 5 classes, and the kids would not let me get off the Zoom. I mean, I had such a great time with them. They were only 5 and 6. They were kindergartners, and they were like, "Oh, you're really doctor? What's my name?" And I can see their names. The teachers, I had told the teachers to put their names on the bottom of their pictures. So I was able to talk to them and call them by name, and they felt so empowered by that. Just a little bit goes a long way.
Tell us how we can get in contact with you. If someone is interested in that, how can they get in contact with you?
As far as collaboration, I'm on every social media platform at Dr. Emily Orthodoc. So it's at DREMILY ORTHODOC. So I'm on Twitter, LinkedIn, Facebook, and IG. Also, the books can be found on the website www.mydoctorlookslikeMe. It's all spelled out. My MYDOCTORLOOKSLIKEME.com. And there's information about the books and the website on there. And the Children's Club also. The Children's Club also has a Facebook page that looks like Me Book Club. They can go on there and see, and find out more information about what we're planning. And then, and as far as my IME Academy, where I train physicians to become medical experts, is www.theimeacademy.com.
All right, very good. And Dr. Stevens, before we let you go, we know you practice in the greater Dallas area. How can people get in touch with you if, people in the Dallas area? We reach out to people in Dallas, and, people want to fly in from Atlanta or the DC area. How can they get in touch with you?
Sure. The easiest way is our website. It's the name of my group is Texas Bone and Joint, and our website is www.tbjortho.com. So that's the best way to get my office number.
A former roommate of mine in college knows you well. He's a pain doctor, Dr. Torrance Steptoe. I don't know if you.
Oh, yes. I did not know that was your roommate.
Roommate for 2 years.
Okay.
Sure was. So, yeah, the world is small. So,
yes.
Things about you. So, and on that note, ladies, we're going to end this for today. I really enjoyed you all. And like I mentioned when I wrote you, I think both of you all are entitled to your own shows, but I was trying to prove a point. The show that this world exists to people who may not realize it. So we will see each other again. I would love to have you all back on the show. We'll have an update and see what's going on there. But for now, we're going to end the Dr. Selwynn Howard show. And we also going to congratulate each other on 30 years of being medical
30
doctors.
years.
30 years. Yes. And we still look great.
That's right.
Except for the hair is gone. This is, but you guys really look good. I mean, nobody would know the difference here. So everyone have a great day, and we will see you next time.